Well, hello, everyone. Thank you for joining us in our first official webinar for the online Bachelor of Science in Public Health program offered here through the University of Cincinnati online. My name is Andrew Gowder. I work as an enrollment services advisor for the program. I work on a team of several other advisors who will initially connect with you in your initial inquiry with the program. I'm joined today by my two colleagues here at UC, Michael Woodward and Reagan Johnson. I will go ahead and pass it over to Michael to introduce himself a little bit.
Hi, everyone. My name is Michael. I'm the academic advisor for the public health program. We're a small but mighty team, but really excited to be part of it.
Hi, everyone. My name is Reagan Johnson. I am a faculty member, so I teach classes in the public health program, and I also serve as the program director.
Cool. Thanks, guys. So before we dive into program specifics, I wanted to run through a quick agenda here of all the items we'll be covering this afternoon. So starting, of course, with program highlights, which Reagan and Michael will be running through us. We'll talk a little bit about why you should choose or consider the University of Cincinnati to further your education. We'll, of course, discuss the curriculum that this program navigates through, as well as other key information to walk you through the application process, including deadlines, application requirements, and then, of course, provide you with information about the tuition and financial aid that is available to you as prospective students. With that said, I will go ahead and hand it over to Reagan and Michael.
All right, so I'm going to talk a little bit about our faculty. And so we have a lot of faculty to support our program. And what's really awesome about our program is that we have faculty from many different colleges. So we have these experts that bring this special knowledge and skill to our program. Many of our faculty not only teach, but they have also industry experience as well, which they bring into the classroom, as well as research experience, which they often get students involved in. So we have a really supportive faculty structure here at UC.
Along with that, we have a really awesome staff structure that allows students to feel supported from start to finish. So thinking about the students that come into our online program, they not only have myself as the academic advisor there for support, but we also partner with UC Online so that our students are getting a student success coordinator. And myself and the student success coordinator support students through connecting to the university, connecting to the major, and making sure that students feel like they are a part of the program, a part of the university, and successful in their endeavors. There's flexible scheduling with our program, so students can start spring, summer, fall, whatever works for them. And on top of that, it's 100% online. So students are never needing to feel like, oh, I have to log on to Zoom for a synchronous online class. All of this is done completely asynchronously online. So with that, keeping in mind some of the busy working professionals that we have that are a part of our program. So taking classes on top of everything else that students tend to have on their plate. And all of this information is in the program overview part of our website.
And so now we're just going to show you a quick video that talks a little bit more about our program.
The Bachelor's of Public Health program prepares you for a variety of community roles where you may work as a health educator in a health department around child and maternal health, emergency preparedness, coordinating disaster relief. They can do their coursework on their own time when it fits into their schedule. We know that individuals have barriers and obstacles to completing their degree. We didn't want their education to be one of those obstacles.
We have an excellent opportunity for students who are interested in a career in improving the community's health and wellness. If this program sounds interesting to you, you can go ahead and enroll today.
So if you move to the curriculum part of the website, you can see an overview of what the Bachelor of Science in Public Health curriculum looks like. It's broken down into basically three different areas. The first area being the public health core, where students are taking those core public health classes and some of those general education requirements that the university requires. There are a number of different electives that students get to choose from. The cool thing is those are part of the degree. So when students are coming in and they have an interest in specific areas of public health, they get credit for some of those exploration classes that they get to take on some of the different public health issues that are out there. And then there is a culminating internship that students take. It is a 3 credit hour internship. So when students are working out in the field for their internship, they're getting credit for that as well, which is a really unique and awesome part of the degree. If we go on to the next slides, we'll see a little breakdown of what this could look like for a student coming in. So here's where you can see for the first 2 years of the program, an example of what students would be taking. Not necessarily all of these are in year 1 and year 2 specifically, but there's where an example of what a student could take coming in could include some of these classes that are part of the curriculum. That continues on to the next slide that has the final 2 years of the program with that culminating internship in that final semester, but showing a mix of that public health core with those general education courses and those public health electives all kind of sprinkled in for students to take throughout their time in the program.
Perfect. Thank you, Michael. So now that we've kind of covered initially what the curriculum consists of, wanted to go ahead and discuss what is required of students interested in pursuing our Bachelor's of Science in Public Health. So as you can see, we've divided our admissions requirements into 2 categories. On the left, you'll see what a first-year student would be expected to have as their background, as well as the transfer student. So let's go ahead and cover the first-year students' expectations first. So this type of student is someone who has never attended college, so has no college credits to their name at this point. So the expectation for that individual would be to be able to provide a GED that has been completed or a high school diploma demonstrating a cumulative high school GPA of at least 2.7, as well as any other university-specific requirements, which can all be found on UC's general website. We did want to point out that our program has actually been split into 2 potential paths for students, that being the Associates of Science in Public Health, as well as the Bachelor's. For students who typically have less than 24 credit hours, we strongly recommend looking into the Associates program, as their tuition is significantly less than the Bachelor's. So if you're looking to start fresh and don't have too many credits to your name, we highly recommend researching that route and would be more than happy to connect you with the necessary advising team. Now, if you have prior credits from another institution that you are hoping to transfer some or all to the University of Cincinnati, the requirements on the right are going to go ahead and apply to you. Those, of course, include maintaining a cumulative GPA of at least 2.0, as well as having accumulated at least 24 prior college credit hours. So again, that 24 credit hour mark is the threshold that we use to recommend which path you pursue. We wanted to also go ahead and highlight the necessary materials that we would need for your application to our public health program. On the left, you'll see all we need is that high school transcript or GED, assuming you have no prior college experience, or of course, if you are a transfer student, being able to provide UC admissions, official transcripts from all prior institutions that you've attended, and those can of course be sent to our UC Office of Admissions. For any questions about that, please direct them to myself or any one of the enrollment advisors that get assigned to you. And of course, you can see at the bottom of the screen, this information is found on the admissions requirements tab on the Public Health Program's website. So moving forward, now that we know what's expected of you as a potential applicant, you want to go ahead and determine what your time frame for starting this program would be. So for reference, the University of Cincinnati offers 3 semesters every calendar year, a spring, summer, and fall semester. Right now, we are currently in the midst of our summer term. However, our next available semester is the fall term beginning on August 21st, as seen on the screen here. Applications for that semester are going to be due in just a few weeks, July 1st of 2023, but you can also see some of the future dates in case the next semester doesn't quite work out for your schedule. And you'll notice typically those application deadlines fall a little over a month before the start of classes. So those really do tend to sneak up on students, and we recommend on starting the application process as soon as you possibly can. So now, of course, the decision to pursue any degree within higher education is just as much a financial one as it is academic. With that, we wanted to go ahead and include our tuition rates for the upcoming fall 2023 semester for this program. You'll notice that there is a slight difference between the rate that an Ohio resident will pay versus a non-resident. While the difference is not great, it is worth noting that there is one. So go ahead and use this table here as needed to determine which rates would apply to you. It is worth pointing out that students considered part-time are those who are taking anything less than 12 credit hours in a semester, whereas a full-time student is taking 4 credit hours or more. And Michael, Reagan, you guys are able to correct me if I'm wrong here, but just about every single class within this program is a 3 credit hour course. So a full-time student in this program would be taking 4 or more classes. If you feel that that is a course load you wish to pursue, that column on the right will indicate roughly what your tuition will be for that specific semester. And of course, that can most importantly be found on the tuition tab of the website on the bottom right there. So of course, you can't discuss tuition without, of course, looking into financial aid and scholarship opportunities. At this moment in time, there are no program-specific scholarships for our public health degree. However, UC does accept various forms of external financial aid that students are able to get their hands on, and we definitely want to outline a few of those to you this afternoon. So of course, starting with the most classic example of FAFSA, or federal-based aid, you're able to visit their website. You can ask your your enrollment services advisors, such as myself, to go ahead and provide you with our school FAFSA code. You can go ahead and fill that out during the application to find out what federal aid you're eligible for. Additionally, we as enrollment advisors have saved various scholarship websites that you can ask for, and we can provide you links with to go ahead and apply to external scholarships, which can be applied here at UC. If you have a military or armed services background, we also have additional benefits as needed and can certainly point you in the right direction, certainly to our VA office as well on campus. We do offer a tuition payment plan, which you can opt into. More information can be provided on that as well upon request. And then lastly, we recently launched a new University to Business Partnership Program, which essentially offers our partner organizations to the university with scholarships to all of our UC Online programs. If you believe that your employer is a U2B partner of UC Online or are interested in having them join our network of organizations, please let us know, and we'd be happy to begin that process and initiate contact. So moving on here, we'll go ahead and cover some of the frequently asked questions that we do get for this program. I will go ahead and hand it off to Reagan, I believe, who will cover the first few questions.
Yeah, so we often get questions about what can you do with a degree in public health, which I think can sometimes be overwhelming for some because there are so many opportunities and things that you can do with an undergrad degree in public health. The other exciting thing is that there's a lot of opportunity in the workforce right now. It is a growing workforce. And so getting a job in public health, it isn't hard. There are a lot of opportunities out there, but the video talked a little bit about it as well, but our students go into all types of field. It really does depend on what you're passionate about, what you're excited about. Oftentimes our students come to us because they have, lived experiences or are passionate about something specific, but you may want to go work in a health department where you're working to address community health issues. Some of our individuals go and work in nonprofit organizations where they might focus on one particular health and wellness topic, for example, an American Heart Association or American Lung Association or something like that. But the idea is that public health professionals protect the health of the public. And you can do that in many different types of settings and situations. We have individuals that go work in worksite wellness. So they may work in a organization helping the employees with wellness initiatives. So as far as what where people are working. There are lots of different places that people are working. Some of the best things about this program, I think, is that we really work hard to not only educate students about public health and give them the education they need to be public health professionals, but we really focus on career planning. Because public health is so broad and big, what do you want to do with a degree? How can we help get you there? And so really working with students along the way in their coursework. We have a few classes that students take that really do focus on professional development that they take at different times. So there are lots of opportunities for students to explore their interests, starting with that first semester when you come in and learning about what you can do with a degree in public health. And our students will learn a lot of things. And so from those basic public health concepts, which we talked about earlier, but also choosing electives that excite you. So if you're interested in nutrition, or you're interested in epidemiology or environmental health, there are classes that you can take that will give you more information and help you guide you along the way at the part of public health that you are really interested in. And then going back to that first point there, when we think about salary, typically an entry-level public health professional is beginning to make somewhere between $40,000 and $45,000 a year, maybe a little bit more depending on the job setting that you work in. But there are lots of opportunities for growth in many of these public health settings. So after you get to the entry level, there are oftentimes opportunities to grow in those settings as well.
Awesome. Thank you, Reagan. I will go ahead and cover the next two questions. The first one, of course, being how easy is it to enroll in the program? We did cover this a bit earlier regarding the application process. I always advise students that the first step that you can take would be to go ahead and fill out a request for information on our website. You have the option to select any one of the over 100 online programs that we have. Depending on which program you select, you'll be connected with an advisor, and then such as myself, and then that advisor will walk you through the entire process. Keeping things short and succinct, however, it's as easy as applying, waiting for a decision, and then connecting with an advisor to discuss which courses you will eventually enroll in, which I'm sure Michael could say a thing or two about. And then, of course, the next question being, why should I choose UC Online? Again, at the end of the day, we really believe it comes down to student support. The University of Cincinnati has developed a system in which we are able to support a student truly from day one until graduation. And day one is not necessarily just the first day of classes, but rather the first day you become interested in our program. So from that first inquiry, whether that's that first email or phone call that you make to us, making sure that you have all of your questions heard and answered thoroughly through walking you through the application process, instructing you where to send your transcripts, ensuring that this is the program that you want to pursue. And then, of course, once you're admitted, getting you connected with your own student success coordinator, who you can connect with at any point in your entire tenure with the University of Cincinnati, as well as having a dedicated academic advisor in Michael. We fully believe that we've created an environment for students to not only be able to succeed in their academic endeavors, but to be able to do so in such a way that they are not alone, despite being a fully online program. I will go ahead and turn it over to Michael to discuss the final frequently asked question.
Yeah, so I feel like I have a lot of opinions on this just because I've met with a lot of students who maybe are on the fence with figuring out whether this is the right path for them or not. Whether that be their particular interest in public health or whether that be all of the other things that they have going on in their life. So for me, what would I say to someone who's on the fence about enrolling in the program? I think you have an awesome support community here. If you do choose to come to public health, if you choose to come to our program, there are a lot of opportunities out there in the world within public health. So if I have students who are on the fence with whether or not this is the right program for them, this is a great general degree for you to then be able to go on to more specialized work in graduate school if that's something that you're interested in. So for any student who's just on the fence as to whether public health is for them, I think this is a really awesome way for students to figure out how to change the world just from their small little community that they may be a part of and grow from there. If they're wondering whether or not, enrolling in this program would be the right program for them, given that it's, an online program, we have a really awesome structure set up to support you from the time that you start to the time that you would walk across the stage at graduation. So we're a really great community to support you, not only within the program itself, but at the university as a whole. So that would be my, 2 cents as to, if you're on the fence, that's stuff to think about. You don't get that with every program. So that's maybe just something to add to your support as you're thinking about your journey in higher education.
Perfect. That was very well said. Thank you for that, Michael. Perfect. So if you are interested in connecting with any one of us individually, whether that's Reagan, Michael, or myself, we've included our contact information here, and obviously we'll make this presentation public to students. Our email addresses are listed there as well. And we lastly wanted to thank you all for spending a bit of your time, whether you're watching this in the morning, afternoon, or evening. We encourage you to follow us on our social media platforms listed there. And thank you again for your interest in our online public health program.